Hey folks, this is Danny Cook. I am sitting outside Holston Valley Medical Center for the 26th day of our peaceful protest against the changes that Ballad Health has proposed and some of the changes that they have already begun to implement throughout our healthcare system. And I wanted to start to do some of these videos. More and more people are becoming aware of what's happening and what the impact of these changes are going to be in our hospitals and in our communities. And so I know that, going back and trying to watch 7 months of Facebook Lives to get an in-depth understanding of everything that's transpired over the last 7 months is a lot. So what I thought I would do is kind of do a couple of quick short videos, break some of the information down so that it's easily digestible and maybe help you get caught up to speed so that you can make a stand and try to protect our healthcare and save our hospitals. So the very first thing that I want to talk about is the COPA, the Certificate of Public Advantage. What is it? Why do we have it? Why did we have to have it? Or did we have to have it? So that you kind of understand that. And what does it mean that now that they have a COPA, does that mean everything is done and there's nothing we can do about it? We're going to take a look at that really quickly. So the Hospital Cooperation Act of 1993 is the law that was originally on the Tennessee books to help rural hospitals, be able to work together to provide adequate healthcare, quality healthcare to residents in rural communities where hospitals have a harder time generating revenue. Now you might be asking, well, why do rural hospitals have a harder time? Well, typically in rural communities, you have more people that are on government insurance, whether that's Medicaid, Medicare, TRICARE. You have, less private insurance, and you have a fair amount of self-pay / no pay. So it makes it difficult because the way that Medicare pays, they have what's called a wage index, and that wage index is set up a little bit almost like your geographic in terms of like what you get paid. So for example, if you have a gallbladder surgery here in Kingsport and then you had that same gallbladder surgery in Atlanta, then Medicare is going to reimburse the hospital and the physicians in Atlanta more than they would here, even though it's the same surgery, requires the same equipment, requires the same skill set. So hospitals in rural communities are penalized simply because we're in a lower economic area. So that's one of the reasons why our hospitals have a hard time. So this Hospital Cooperation Act was intended to allow, for example, Mountain States Health Alliance and Wellmont Health Systems to cooperate. They could have worked together. What that law said was they could share physicians, they could have shared patient referrals, they could have shared equipment, they could have worked together to make sure that the citizens in this area still had quality health care and those hospitals could remain profitable. What happened is our hospitals chose to compete rather than cooperate, and they raised the level of debt to a very substantial level. So at the time of the COPA, Wellmont Health System had $411 million in debt. Mountain States Health Alliance had $892 million of debt. However, don't let that deceive you. Both of these hospitals were still profitable, okay? So right before the merger took place in 2017, Wellmont Health System had doubled its net income, its net profit in the year prior. So don't let that debt make you think that they weren't still making money, because they were. Matter of fact, they'd kind of stabilized their revenue and were on their way out. And there were some other options on the table. However, what they preferred to do was to pass a new legislation that amended that existing COPA law. And the new law that they passed in 2015 said that not only could they cooperate and work together, but in fact, they could merge, and that the state would displace competition, right? In other words, the state knew it was intentionally creating a medical monopoly, right, in exchange for oversight. And because the state was going to be overseeing this medical monopoly that they were intentionally creating, then Ballad Health would get immunity from state and federal antitrust laws. So for those of you guys who said, well, why in the world didn't the FTC step in and do something? Well, that's pretty much why. Who do we have to thank for that bill? Well, you have a lot of your state representatives, Eldridge and Hawk and Bud Halsey and, a lot of those guys. And then on the Senate side, you have former Speaker Ron Ramsey, you've got Norris, and you've got Senator Rusty Crowe. Those are the guys who sponsored and passed that legislation, creating the medical monopoly that we currently have right now in the Tri-Cities region, Southwest Virginia, Northeast Tennessee, Southeast Kentucky, and Northwest North Carolina. So that is the COPA in a nutshell, what it means, how it came to be, and hopefully that helps clear up some things. I'll see you guys in the next video. Peace.